All right, buckle up because I'm about to give it to you straight, and it's probably going to make a lot of you uncomfortable. Most people over 65 are being left in the dark about critical medical information that's literally a matter of life and death. Nobody wants to tell you this because it's easier to hide behind medical jargon and polite half-truths. But today, I'm ripping the bandage clean off. We're going to confront 7 brutal medical realities your doctor either doesn't have time to explain or just plain doesn't want you to know. So if you think crossing 65 was just another birthday, you'd better think again. You've entered a whole new arena, and the medical world frequently has a habit of brushing aside your concerns or quietly omitting the blunt facts. This can lead you straight into serious complications you weren't even warned about. But I'm here to blow the lid off all of it. And let's be real, you might find yourself thinking, why isn't my doctor telling me this? The truth is, plenty of health professionals skirt around the more distressing details for fear of scaring you, or because they assume these complications are just normal for older adults. That's an insult, and it keeps you from making the best decisions for your own longevity. So brace yourself. We have 7 points to get through, and each one might leave your jaw on the floor. But pay attention, because each of these 7 truths carries a solution. I'm not here just to shock you. I want you to walk away knowing exactly what to do next. Let's get into the first one. The first medical truth that doctors often hide from you is just how quickly your body's ability to fight off infection can deteriorate after 65. Oh, they'll mention weakened immune systems, but they won't tell you that even a minor infection can spiral into a life-threatening condition if not treated aggressively. That tiny gum infection, that mild urinary tract infection, or that little cut on your arm can balloon into something enormous because your immune response is no longer as strong. The consequence is that you're left walking around thinking it's just a small thing while the bacteria multiply. And with certain antibiotic-resistant strains on the rise, it's more important than ever to take swift action. Here's your solution. Any sign of infection, no matter how small, needs your attention. Don't put off calling the doctor or heading to urgent care. Prioritize prompt treatment and track changes. If a sore throat lingers, push for tests. If you suspect that cut on your arm is getting redder, keep a log of your symptoms and demand thorough checks, not just a quick glance. Overreacting is far better than underreacting at this stage of your life. Believe me, ignoring a little infection can send you to the hospital for weeks. You think your doctor's going to emphasize that possibility every time? Probably not, but you deserve that truth. Moving on to the second medical truth. Many doctors will hint at kidney or liver function changes as you age, but they rarely drill into the horrifying reality of what happens when these organs start to fail. Both kidneys and liver are your body's powerhouses for filtration and metabolism, and as you age, they can slow down drastically, especially if you're on multiple medications. Those prescription drugs might be building up because your kidneys or liver can't clear them out as quickly, turning what should be medicinal benefits into a toxic brew. This buildup can cause all sorts of side effects, from persistent fatigue to damaging your heart. But is your doctor telling you to demand specific tests every few months to ensure your body is still metabolizing your meds effectively? Probably not. The medical system likes to assume you'll schedule a checkup if something feels off. That's a gamble. So here's the fix. Be proactive. When you visit, request labs that check your kidney and liver function. Ask your pharmacist if your medications can negatively interact with each other and confirm how often you need tests to keep track of toxicity. You have to be the one to insist because healthcare providers might not volunteer this info. They often assume you know to do it or that some other specialist will handle it. Advocate for yourself so you don't become a casualty of unmonitored medication. Third medical truth. Doctors often downplay the risk of delirium and sudden mental confusion, especially after hospital stays or surgeries. You might go into the hospital for a seemingly minor procedure, and then suddenly you're disoriented, hallucinating, or struggling to remember where you are. The medical term for this is hospital-induced delirium, and seniors are at the highest risk. Why aren't they sounding the alarm? Often, hospitals just chalk it up to old age or expect families to cope. This delirium can linger, sometimes leading to lasting cognitive decline if not handled aggressively. It's terrifying for you and your loved ones, and it can set you on a path of deteriorating mental function you never bounce back from. So what's the solution? First, be aware of the risk. If you're going in for any extended hospital stay or surgery, talk with your healthcare team about strategies to prevent delirium. This might mean planning for minimal sedation, ensuring you have glasses or hearing aids to keep you oriented, or asking family to stay with you so you're less isolated. Also, push for early mobilization. Lying in bed for days is a recipe for confusion. Doctors may not mention all this unless you demand it, but ignoring delirium could mean never fully regaining your previous mental clarity. Fourth truth, if you've ever noticed that your pain complaints are brushed off, you're not imagining it. Seniors get their pain overlooked or minimized all the time. Some medical professionals think a certain amount of pain is just part of aging, but the uncomfortable truth is that ignoring or undertreating pain has real consequences. Chronic pain can sap your energy, increase your risk of depression, and even slow your recovery if you're dealing with surgery or illness. But were you told that effective pain management can significantly improve both your mental health and physical healing? Probably not in plain language. Doctors are busy juggling pain medication regulations and side effect concerns, so they often err on the side of giving you less information or fewer anti-pain measures than you might truly need. Your solution is to be relentless about describing your pain and demanding appropriate interventions. Keep a pain journal, detail precisely where it hurts, how severe it is, and what aggravates it. Show this record when you see your doctor and don't accept vague dismissals. Insist on exploring different modalities, physical therapy, targeted injections, or even carefully monitored prescription options. You do not have to live with pain simply because you're over 65. And yes, comment, "Truth hurts," if you know exactly what I'm talking about here. Fifth hard fact, senior malnutrition is a silent epidemic. It's not just about skipping meals. It's about lacking essential vitamins and minerals that can keep your heart, brain, and muscles functioning. Did you know that 1 in 3 hospital patients over 65 is malnourished or at risk of malnutrition? You might be eating, but are you actually taking in the nutrient density you need? Doctors often fail to emphasize this beyond a feeble, "Try to eat balanced meals." That's not enough. You need specifics and follow-up. You might need more protein than you did in your younger years. Supplements like vitamin D, vitamin B12, or calcium could be absolutely critical. So what do you do? Start by asking for a nutritional panel during your checkups, and take those results seriously. Consider consulting with a dietitian who specializes in seniors if you can. Focus on high-quality proteins, fruits, and vegetables, and limit empty calories that fill you up but don't strengthen your body. This is not optional because malnutrition leaves you vulnerable to infections, weak bones, and slow wound healing, and can absolutely sabotage your health goals. Sixth uncomfortable reality. The hospital is not always the worst place to catch a serious infection. You probably assume that going to a clinic or imaging center is safer. Spoiler alert, not necessarily. Any environment where sick people gather can be a breeding ground for superbugs, drug-resistant bacteria, and viruses that your aging immune system might struggle to fight. Doctors might casually mention, "We see a lot of flu going around," or "There's MRSA in the hospital," but they rarely drive home the do-or-die importance of infection control. Short of living in a bubble, there is a lot you can do. Wash or sanitize your hands often, especially after touching surfaces like door handles. Don't be shy about wearing a mask if your area is dealing with an infection surge, and if you need a test that can be done in a less crowded facility, request it. Clearly state your concerns. "I'm over 65 and I want to minimize my exposure risk." Healthcare workers might roll their eyes, but guess what? It's your life, not theirs. Being super cautious with your environment can sometimes mean the difference between a quick recovery and a lingering hospital stay. Seventh and final medical fact that no one wants to say out loud. Many doctors assume you won't make drastic changes to your lifestyle, so they don't bother to outline how critical it is for you to keep active, watch your weight, or maintain muscle mass once you're over 65. This is a disservice of the highest order. Daily movement, even if it's just a walk around the block or some light resistance training, can be the deciding factor in whether you fall and break a hip or remain mobile. Maintaining muscle mass drastically affects how your body processes medications, heals wounds, and avoids falls. If your doctor isn't pounding the table about the importance of strength and flexibility, you need to demand a plan. Ask your physician about senior-friendly exercise options. Bring up the possibility of physical therapy or classes in your community. The biggest mistake is sitting back and assuming small changes won't matter or that it's too late. It's never too late to develop more strength or better balance. And trust me, your golden years can be extended by keeping your muscles in decent shape. Now that you've heard these 7 truths, do you see how the system can fail you by omission? This is your health on the line, so you have to step up and challenge every assumption. Don't wait for someone else to start the tough conversations. Don't rely on your physician to volunteer every obscure piece of vital info. Demand thorough explanations, second opinions, and more frequent checkups if you suspect something is off. Remember, an "oh, it's probably nothing" attitude could cost you big time. If you've made it this far, you're among the few determined to face the brutal truths head-on. Good. Now do something about it. Arm yourself with knowledge and action. If you want more raw honesty on topics most people tiptoe around, hit that like button and subscribe to this channel. And I dare you to drop a hashtag truth hurts in the comments if you've ever felt your doctor was holding back vital info. Let's keep each other informed and unafraid. The reality is that these medical issues aren't going away, and none of us are getting younger. But by facing these truths and demanding the care we really deserve, we can put ourselves back in control. That's the real power here. Take it, and I'll see you in the next video.